Okay, thank you, Madam Chair, and thank all of you for being here. I want to start, and bear with me here before I get into my questions, but it seems like we had a bullying problem with this administration. I mean, our first witness that was supposed to be here this morning is not here because he resigned last night because of supposedly bullying. Dr. Fauci, another example of bullying us into having to take vaccines and having to wear masks, all examples of bullying. You look at Dr. Kessler and Dr. Levine bullying governors into not using monoclonal antibodies, which have been proven to be effective, and then limiting the supplies of those. The administration bullied Americans into not using ivermectin, calling it a horse dewormer, when actually it has worked for many people, been effective. And then you've got U.S. Trade Representative Catherine Tai, who's tried to bully American pharmaceutical companies into giving their intellectual property free of charge to China. There's a common theme here, and it's bullying, and it needs to stop with this administration. Now that I got that off my chest, Dr. Miller, I want to ask you. We've got a lot of serious public health challenges in this country. There's no question about that. And I recognize that in my 30-plus years of practice in pharmacy. And we need innovation. We need treatment innovation for lymphedema, cancer, hypertension, and all kinds of things. But I'm especially concerned about the prevalence of antimicrobial resistance and the need for new medications. ARPA-H proposal suggests an entirely new department is needed to address the lack of cures and treatments for these issues. And one of our colleagues on this committee, Morgan Griffith, had recommended the book, The Perfect Predator. I don't know if you've read that or not, but I'm right in the middle of it, and it's a fascinating, true story, fascinating read. But I will tell you, NIH gives out billions of dollars every year to different agencies, to different companies. And I get it. I understand what their role is and what they're supposed to be doing here. But sometimes you have to wonder if we're getting the return on our taxpayers' money that we should be. And it looks like there's a lack of transparency and accountability at the NIH, and it's concerning to a lot of us. Dr. Miller, what can Congress do? What could we do to reform and modernize NIH and its mission for advanced research before opening an entirely new department as has been proposed?
Thank you. I think this brings just a couple core questions to us about sort of how to run a research enterprise. Like my colleagues have all said, and I agree with, you want to minimize bureaucracy, right? So just blowing that bureaucracy away, why is the grant guide 154 pages long? I mean, that's longer than most people's grants. Could you imagine writing a grant in response to that? So I think blowing that away, creating a culture of risk tolerance and that culture of tolerating failure and supporting failure as we think about platforms, as we think about new big ideas. All these principles that my colleagues are mentioning are principles that we should try and integrate into the NIH, and we need to change that culture.
Well, thank you for that. And let me ask you, again, Admiral Joar, is he with us?
Yes, Admiral he is.
Joar, yes, thank you. I wanted to ask you, I've mentioned my concerns about the prevalence of antimicrobial resistance to drugs that are currently on the market, and I've certainly witnessed this in my practice of pharmacy throughout the years, and the overuse of antibiotics, the lack of pharmaceutical companies investing into research and development for new antibodies. I believe it's like the early 80s, the last that we had. And we need to address that. We have got to address that in this country. And I'd rather government stay out of it, but at the same time, I don't know how we're going to afford not to. We've got to stimulate this in some way. But looking back on your time at HHS, Admiral, I wonder if you can fill us in on why BARDA and other federal agencies aren't equipped to address these needs. Is there room for reform at BARDA and NIH and other research programs in federal government to address these type of gaps?
Well, thank you, and it's good to see you again. And I'm a big pharmacist fan, and I think ARPA-H could do a lot to support pharmacy and distribution of care. These are fundamentally different organizations. BARDA has turned into, and it is fine, a truly advanced development group on a limited mission set that is for biodefense. So you see investments being made, like taking an underlying technology that might have been developed by DARPA and making sure it gets approval for influenza or making sure it gets approval for COVID. So it's in a fundamentally different operating space. And I would say its processes are highly bureaucratic and not really that quick, agile type of program. On the other end, you have the NIH, which we've discussed very much. So there is, of course, room for reform across the board, but that bridging of the gap that ARPA-H can do, not to displace the private sector, but to empower the private sector, to decrease risk for the private sector, to create technologies that a rising tide will raise all boats. This is all the kinds of things that ARPA-H will do. And let me just say, in terms of equity, we talk a lot about cures. Just as you and I talk so much about distributing healthcare by using pharmacists, I think an explicit goal of DARPA should be to get care and prevention in the homes, particularly of the underserved and the rural. That may not be as sexy as curing stage 4 cancer, but it is vitally important and is along the lines of distributing equitable healthcare and meeting people where they are.
Thank you, Admiral, and I thank you for your indulgence, Madam Chair, and I yield back.